Kristen Heather Gilbert, formerly known as Kristen Strickland, born on November 13, 1967, is an American ex-nurse infamous for her involvement in a series of heinous crimes. She was found guilty of committing 4 murders and attempting to murder 2 patients while working at the Veterans Affairs Medical Center, VAMC, in Northampton, Massachusetts. Gilbert's modus operandi involved causing cardiac arrests in patients by administering significant doses of epinephrine, a heart stimulant commonly known as adrenaline, into their intravenous therapy bags. This method left no trace, making it difficult to detect her actions. Subsequently, she would swiftly respond to the emergency code, often taking it upon herself to resuscitate the patients. Prosecutors revealed that Gilbert was on duty for approximately half of the 350 deaths that occurred at the hospital since she began her employment there in 1989. They argued that the likelihood of this being a mere coincidence was incredibly low, estimated at 1 in 100 million. Nevertheless, Gilbert was only conclusively linked to the deaths of Stanley Jagodowski, Henry Huden, Kenneth Cutting, and Edward Squira. Early life. Born as Kristen Heather Strickland in Fall River, Massachusetts, on November 13, 1967, Gilbert was the elder of 2 daughters born to Richard and Claudia Strickland. Richard pursued a career in electronics, while Claudia divided her time between homemaking and part-time teaching. During her teenage years, those close to her began to notice a troubling pattern. Gilbert had developed a habit of deception, often resorting to faking suicide attempts as a means of manipulating others. Court records show that she had been making violent threats against others since her adolescence. Gilbert completed her education at Groton-Dunstable Regional High School in Groton, Massachusetts. In 1986, she enrolled at Bridgewater State College, also in Massachusetts. However, following a fabricated suicide attempt, college officials mandated psychiatric treatment for her. Consequently, in 1987, she transferred to Mount Wachusett Community College in Gardner, Massachusetts, before ultimately finding her way to Greenfield Community College in Greenfield, Massachusetts. It was at the latter institution that she successfully graduated with a nursing diploma, officially becoming a registered nurse in 1988. It was also in that same year when she entered into marriage with Glenn Gilbert. Career and crimes. In 1989, Gilbert joined the staff at the Veterans Affairs Medical Center in Northampton. Her presence was featured in the April 1990 issue of VA Practitioner magazine. Although other nurses noticed an unusually high number of deaths occurring during Gilbert's shifts, they often dismissed it as a coincidence and humorously referred to her as the Angel of Death. However, in 1996, 3 nurses raised concerns about a surge in cardiac arrest deaths and a shortage of epinephrine, prompting an official investigation. In an attempt to thwart the inquiry, Gilbert resorted to making a bomb threat over the phone. As the hospital investigation into the suspicious patient deaths during her shifts unfolded in 1996, Gilbert decided to leave her position. During that fall, she admitted herself to psychiatric hospitals on 7 separate occasions, with stays ranging from 1 to 10 days each time. In January 1998, Gilbert faced trial for her bomb threat to the Northampton VAMC, which was intended as retaliation against her co-workers and former boyfriend, James Perot, who also worked at the hospital, for their involvement in the investigation. In April 1998, she was convicted of this crime. There were speculations among VA hospital staff members that Gilbert might have been responsible for as many as 350 deaths and over 300 medical emergencies. During her trial, Assistant U.S. Attorney William M. Welch II, the prosecutor, argued that Gilbert used these emergency situations to draw the attention of her then-boyfriend, Perot, a VA police officer, as hospital rules mandated the presence of police during medical emergencies. Perot testified against her, stating that she had confessed to at least 1 murder over the phone while she was hospitalized in a psychiatric ward. Defense attorney David P. Hoos raised reasonable doubt based on the absence of direct evidence. Dr. William Boutelle, a psychiatrist who served as the chief of staff at the Northampton VAMC, suggested that Gilbert may have created emergency medical crises to showcase her nursing skills. During the trial, prosecutors alleged that she had used a large kitchen knife in an assault in Greenfield, Massachusetts, in January or February 1988. They also claimed that she had attempted poisoning someone twice in November 1995 and had tried to poison a patient at the VA hospital on January 28, 1996. Additionally, they accused her of causing a medical emergency by removing a patient's breathing tube at the VA hospital on January 30, 1994. Prosecutors further asserted that on November 9, 1995, Gilbert had abandoned a patient in cardiac arrest and had only raised an alarm after her colleague independently noticed the patient's distress. On November 17, 1995, during another medical emergency, she compelled an untrained colleague to use cardiac defibrillation paddles by refusing to do so herself. In July 1996, Gilbert was said to have verbally and physically threatened at least one person. Furthermore, in her earlier role as a home health aide, approximately 8 years prior to her VAMC crimes, she intentionally scalded a mentally handicapped child with scalding bathwater. On March 14, 2001, Gilbert was convicted by a federal jury on 3 counts of first-degree murder, 1 count of second-degree murder, and 2 counts of attempted murder. Although Massachusetts did not have capital punishment, her crimes were committed on federal property, making her eligible for the death penalty. Prosecutors sought to introduce evidence of aggravating factors during the penalty phase, including Gilbert's 1998 bomb threat conviction, while the defense presented evidence of mitigating factors, including the well-being of Gilbert's 2 children. On March 26, 2001, the jury recommended a sentence of life imprisonment. The following day, the judge officially sentenced Gilbert to 4 consecutive life terms without the possibility of parole, plus an additional 20 years. She was transferred from a women's prison in Framingham, Massachusetts, to FMC Carswell in Fort Worth, Texas, where she has been incarcerated ever since. In July 2003, Gilbert abandoned her federal appeal for a new trial following a Supreme Court ruling that would have allowed prosecutors to pursue the death penalty in a retrial.